What is coronary artery disease, CAD? CAD occurs when the coronary arteries narrow or block. These arteries supply oxygen-rich blood to your heart. The main cause is plaque buildup, which is a mix of fat, cholesterol, and other substances. Risk factor for developing coronary artery disease, CAD. Modifiable risk factor that can be changed. High blood cholesterol, hyperlipidemia. Cigarette smoking, tobacco use. Elevated blood pressure. Hyperglycemia, diabetes mellitus. Metabolic syndrome. Obesity. Physical inactivity. Risk factor that cannot modifiable. Family history matters, a first-degree relative with heart disease at 55 or younger for men, and 65 or younger for women. Age more than 45 years for men, more than 55 years for women. Gender: men develop cardiovascular disease at an earlier age than do women. Sign and symptoms of coronary artery disease: clinical manifestations of CAD. Symptoms and complications depend on where fat builds up in the blood vessels. They also rely on how much fat is present, how narrow the arteries are, and if clots form. This can block blood flow to the heart muscle. Symptoms include the following: ischemia, chest pain, angina pectoris. Atypical symptoms of myocardial ischemia: shortness of breath, nausea, and weakness. Myocardial infarction, MI. Dysrhythmias, sudden death. Medical management of coronary artery disease: treatment of coronary artery disease, CAD. Treatment of coronary artery disease: it may refer to the treatment of angina pectoris and myocardial infarction. Pharmacologic therapy. Nitrates: the mainstay of therapy are nitroglycerine. Beta-adrenergic blockers: metoprolol and atenolol. Calcium channel blockers: calcium ion antagonists, amlodipine and diltiazem. Antiplatelet and anticoagulant medications include aspirin, clopidogrel, heparin, glycoprotein, GP-IABS agents, abciximab, tirofiban, eptifibatide. Oxygen therapy. Prevention. The main goal of management is to prevent high-density cholesterol. For risk factors can be changed: cholesterol issues, tobacco use, high blood pressure, and diabetes. Advice to the patient who has coronary artery disease, CAD. Follow a clear plan to manage the condition. This helps lower the risk of complications like heart attacks or strokes. Medical management advice. Take medications as prescribed by physician. Common medications such as aspirin, beta blockers, ACE inhibitors, or nitrates. Don't skip doses, set reminders if needed. Regular checkups. Follow up with your cardiologist regularly. Check blood pressure, cholesterol, blood sugar, especially if diabetic. Understand your condition. Learn about CAD, recognize symptoms of worsening, example, chest pain, shortness of breath, and when to seek emergency care. Lifestyle advices. Heart-healthy diet. Focus on fruits, vegetables, whole grains, lean proteins, like fish, poultry, nuts, and healthy fats, olive oil, avocado. Limit salt, red meat, saturated fats, sugar, and processed foods. Quit smoking. If you smoke, seek help to quit. It's one of the most powerful changes you can make. Limit alcohol. If you drink, do so in moderation. The recommended amount is 1 drink per day for women and 2 drinks per day for men. Stress management advices. Chronic stress can worsen CAD. Try deep breathing, meditation, yoga, counseling or therapy, if needed. Weight and sleep advices. Maintain a healthy weight, BMI under 25. Get 7 to 9 hours of quality sleep each night. Treat conditions like sleep apnea if present. Physical exercise advices. Aim for at least 150 minutes of moderate aerobic activity each week. This can include activities like walking, swimming, or biking. Add muscle strengthening exercises twice a week. Always consult your doctor before starting or modifying exercise routines.